Hello and welcome. My name is Dr. Treasury. It's lovely to meet you. I understand that you've been having a bit of a problem with what you think might be an allergy. Okay, well let's talk about that a little bit more then. I'll start by going through your symptoms with you, and then we will perform an allergy skin test today, just to see if we can get to the bottom of what's causing your symptoms, okay? Good, alright. So what are the symptoms that have brought you here today? Okay, so sneezing quite a lot. And trouble with your eyes, okay. So when you say trouble, do you mean, are they itchy or watery or red? So mostly itchy. Have you noticed any redness at all? Any discharge? Okay. And you haven't noticed any impact on your sight? Okay. What about other symptoms? So for example, your skin. Have you noticed any rashes? Have you had red skin at all? No? Okay. Is your skin unusually more sensitive than normal? So for example, have you had to change products that you've been using or anything like that? Okay. And what about headaches? Have you had any headaches? Any stomach upsets? Okay. So it's really just concentrated on the eyes and some sneezing as well. How about your throat? Have you noticed your throat's been quite swollen? Okay, any pain in either ear? Okay, none there, that's a good sign. Alright, how long have these symptoms been going on for? Is this quite a recent development, or have you had them a while? Okay, do they change with the weather? Okay. Have you had any lifestyle changes recently? So have you changed your diet quite significantly? Have you changed any other lifestyle factors? Any new pets? Okay. Have you travelled recently? Have you been abroad anywhere? Okay. And are you currently on any medications for anything? And how long have you been on that one? Okay. And are you otherwise generally fit and well, or do you have any other medical issues? Okay. Have you ever had an allergy test before? No? Okay. Well, it's quite straightforward. I'm going to apply some known allergens to your skin, and then it will only take a few minutes just to see if anything shows up or not in the skin. If it does, it might mean that we need to do some further tests, and it will also help us to identify what is causing your symptoms. What I need to do first though is just rule out the fact that it could be an eye infection. It doesn't sound like it, but I'm going to have a closer look just to make sure. Is that okay? Good, alright. So I'm going to use a little pen and light here. Just have a good look inside your eyes. So if you could look directly at me for a moment. That's it, okay? Okay, just look up for me there. That's it. And look down. Look across to your left. Very good, and your right. Great, same for the other eye, so look straight forward for me again. You don't need to look into the light. That's it. Just looking at your eye health, looking for any signs of weeping, stickiness. Okay, so look up for me, that's it. Good. And look down. That's great, well done. Across to your left. Really good. And over to your right side. Okay, good. If you could just blink for me. And blink again. And now hold your eyelids closed for me. So blink them closed, that's it. Just hold them tightly closed. Just running out conjunctivitis. And open them for me. Lovely, so those are opening beautifully. Everything looks perfectly normal there. I don't think we need to worry that there's an eye infection. I'm just going to take a look inside each nostril as well. Okay, that's it. If you could just tilt your head back for me slightly, then we're going to look on the left side first. Just there. Looks nice and clear. Same on this right side and your right nostril. Okay. Good. If you could please hold your left nostril closed for me, that's it. Take a big deep breath in through your nose. Okay, good. And exhale just through that nostril there. Very good. And now swap over. So if you could hold your right nostril closed for me and take a big deep breath in through your left nostril. Good. And exhale. That's really, really good. That all sounds and looks lovely and clear. Okay? So what I'd like you to do is just follow me through to the consultation room. I'm going to get some bits and pieces set up. And if you could just roll your sleeve up for me on your right arm, that's where we will do the test. Okay? You ready? Okay, let's go. Okay, so I'm going to begin just by examining your arm. So I'm going to pop some gloves on. And I'm just going to take a closer look at your skin here. So you said that the symptoms have been mainly in your eyes, is that right? So just some itchiness and a little bit of sneezing as well. So you haven't noticed any other areas on your body where there have been any rashes or raised red lumps or areas signs of unusual sensitivity? No. Okay. So I can see that the skin here is in good condition. There are no signs of current issues. So we're going to be able to test on the skin here. I'm just going to have a closer look with this little pen light. Just looking for any signs of redness at all. So we're just going to use the forearm only for the test today. I'm going to draw a grid on there, and we will test with the 10 most common allergens, but we will also use a positive and a negative control. So we'll have a grid of 12 separate squares. But before I do that, I'm going to need to cleanse your skin just to make sure that there are no residues or oils or any other product on there that you've already used today, because we wouldn't want those to interfere with the results of the test. So if I could just move your arm slightly this way, that's it. I'm going to apply this alcohol-based cleansing lotion directly onto the skin. So while that's drying, I'm going to prepare the allergens. I have an activating solution here, so this is just going to activate the allergens that are in these boxes. It won't do anything more than a very slight raised red lump in an area where you do have an allergy. There won't be any kind of severe reaction, of course, so please don't worry about that. Numbers 1 and 2 are our positive and negative controls, so we'll begin there. We have positive and negative, and then we have 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. Is your arm feeling nice and dry now? Good, okay, so I'm going to begin to map it out then. So if I go 1, 2, 3, 4, that'll be 1, 2, 5, 6, 7, 8, 9, 10, 11, 12. Okay. Create our grid. So starting from the centre line here. We have positive and negative control, and we have 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10 for our allergens. So this one will be our positive. This one will be our negative. And then I just need to mark the individual numbers of the allergens themselves so that we don't get them mixed up. So we have 3, 5, 7, 12, 13, 19, 21, 22, 26, and 28. I'm just going to use some cotton swabs now to swab each of those allergens into your skin. So we will rub them in quite vigorously just to make sure that they take effect. So first positive. So we should notice a small area of redness here, but it's absolutely nothing to worry about. That's perfectly normal for everybody. And then the negative. Then allergen 3, which is an environmental based allergen. Moving down this side of your arm first, we have allergens 5 and 7, which are food based. We then have 12 and 13, which are insects and bites, wasp stings, those kinds of things. And what we do is, if any of those in particular show up, then we can carry out further tests as needed. Do you feel a reaction anywhere so far on any of these areas? Any itchiness or burning at all? you said that you don't have any pets at all. Have any of your friends and family got pets, or have you come into contact with any new animals recently? Any visits to farms, for example, or anything like that? Zoos where they have small animals that you can pet? No? Okay. Nearly there. You've done really well so far. So with the final 2 allergens, we are just testing for reactions to chemicals that you would commonly see in household and beauty products. So this is why we ask if you have any kind of change in your routine in terms of the shampoos or body washes and perfumes that you're using and so on. Okay, final one here. Good, okay. I'm just going to give those a moment or two to take effect just while I tidy these away. How are you feeling at the moment? Any areas or numbers that are causing you any concern? Do you feel a reaction anywhere in the skin? No itchiness at all. Okay, let's take a closer look then. We do expect these to show up very quickly if there are any issues. We don't need to leave them on the skin for long at all. Okay. So I can see here, as we would expect, that you've had the reaction to the positive control very slightly, just a small red area there where it's working, and nothing where the negative control is, so that's really good news. It means that the test has worked as we would expect. And then it all looks perfectly normal here, except for number 3. This was our pollen, our atmospheric allergens, and I can see here that you have had a slight reaction in the skin, and this lines up with what you were telling me about your symptoms before, in terms of how they appear quite seasonally as well. So that's definitely something to look into. So what I'm going to do now is just clean your arm, and then we'll pop back through to the office and we'll have a discussion about your results, okay? Good, okay. So I'm going to remove the grid here. Don't worry, this is completely removable, so if it doesn't come off with a solution, just take yourself down the hall. We have a little room where you can apply some soap, and there's towels there for you as well. Does that feel okay? Alright. Okay, there we go. If you just like to follow me back through to the office, okay? Wonderful, how are you feeling? That's great news. So it does look like you have a pollen allergy, so hay fever. It's very, very common, and luckily there are lots and lots of things you can do to treat it. If you go out to the front desk, I have a couple of bits and pieces that my team will prepare for you so that you can take away today. But what I'm going to do is write up a report to send to your doctor directly so that they can update your medical records and prescribe you future treatments if they feel it's necessary. If your symptoms get worse, more than just itchy eyes or sneezing, then do go and see your doctor right away. But it's great that we have identified what's going on today, because it means we can now manage it for you and hopefully relieve those symptoms entirely. Okay? Lovely. Well, it's been wonderful to see you today. I hope things improve for you, and I will see you again very soon.